Good afternoon, everybody. Today is July 29th, 2022. My name's Scott McGann with the Falmouth Health Department. Doing a weekly or every other week, we get to it, every week or two. COVID-19 update. Our email is health@falmouthma.gov. Our phone number is 508-495-7485. So let's get into this update. As of yesterday, 5,168 total cases since the beginning of the pandemic. 57 over this past 8-day period. Last time I did this was on a Thursday. So generally we do them on Friday. So there were 57 PCR cases. So that's PCR. That's the gold standard. That's not home tests or probable tests that are done at a facility like Convenient MD or CVS. There were 7 of those for the 21st to the 28th, I should say 21st. Again, this does not count home tests which are not tracked, gone through the Maven epidemiological network and all that stuff like PCR is done. So there's a multiplier that's going to be higher, could be a couple of 3, 4, 5 times higher actual case counts. But in terms of where we're at, PCR would still be a good indicator of where we're at compared to other weeks, at least since the home test. So our 14-day positivity was 23.5, which is up from 20.2. We've been sort of right around that for a little bit. Our 14-day positivity is almost 10% at 9.83, which is up from 8.28. If you look at the case counts, each dot indicates a week since the pandemic began. The big giant one's Omicron, came down, and now we're sort of hovering in the far right, 1, 2, 3, 4, 5, 6, 7, 8 weeks of roughly 50, plus or minus, up and down. So that is pretty consistent. We've been in sort of the same pattern this week that we were in last week and the week before that. A couple of these days were 6 days on one and 8 days on the other. Usually they were always on 7 days, so they'll be up a little higher, so this would be a little bit tighter. But we're averaging about 50 PCR, which might be in a couple hundred actual cases when the home tests aren't accounted for. COVID's been on a, I would say, high. If you compare it back into 2020 when we're all shut down, low case counts, and again, PCR and or the rapid antigen at a facility would have been the only test that you would have gotten until this first Omicron spike when home kits started to come in. So you can see 20 and 21, we had better case counts, less COVID around in those prior 2 summers than we have this summer, mainly because, we don't have mitigation. We're not shut down. We're not doing mask mandates. We're also you have variants that tend to spread more rapidly, but tend to be somewhat less severe, especially now with vaccines and treatments. That this is sort of what our background is. It's around 50 PCR positives per week is for a good part of the summer. This chart indicates the flatter the line, the closer the dots are together, the lower the counts are. You can see up in the far right, we're bunched together, so we're not seeing like we saw where these dots here are spread out and gone really high. That's the original Omicron outbreak in January of this year. But we'd like to see that flatten out a little bit. This is an additive, so it doesn't go down. It's just accumulation of case counts by week. And we're still on an upward, not an upward trend in cases, but with the 50 cases a week, that this is not going to be as flat. You need to see case counts down 5, 10, 3 a week, and that would flatten that out. That's where we're at. So looking at what our CDC has a metric where they use hospitalizations and cases. We really need to be gearing, since we don't know what a lot of the case counts really are, we don't actually have an accurate case count, we use hospitalizations because that is a much more accurate measure. It's a very accurate measure of COVID burden on in a municipality or in a county. So CDC uses it by county, and low would be a fewer than 200 cases per 100,000, less than 10 hospitalizations per 100,000, and the number of beds or percentage of inpatient beds used up by COVID patients of less than 10%. So we fall in the medium, which is still under 200 cases, so we'd be up in the category of medium. It would be at 11.4, which is higher than 10, which puts us into the medium, and then our percentages is 3.4, so we're still well below. So we would be in the green if we were under 10 new COVID admissions per 100,000. We're at 11. It's a little higher than the last time I looked. We're at 10 point something. So there's a bit more, and that 3.4 percent is higher than we were under that number the last few weeks. So a little bit more hospitalizations say that there's definitely more COVID, or a little bit more COVID around, even though you're not really seeing it in the PCR, but it's not to a point where it's really getting out of control. The high categories would be greater than 20, equal to or greater than 20 new admissions per 100,000. So on the Cape, about 220,000, somewhere around 42 or 43 hospitalizations among the hospitals on the Cape. And I don't know the true actual bed count from the two hospitals, but greater than 15% of the beds being taken up by COVID patients. And then you would have a lesser degree if you have more cases. So they're using cases down below. If you had more than 200 cases, then they lower these numbers. They basically shift the medium to the high. So sorry to be confusing, but we're in the medium, low medium. We meet 2 out of the 3 categories, but we are higher than the 10 per 100,000 hospitalization. And so we remain in the medium. No mask mandates. No one's really talking mask mandates. I haven't heard that anywhere in the news. There's no mandates or mitigation at this point. You can take care of yourself and wear masks by all means. The more crowded places you are, the more travel you do, the more risk that goes up, especially indoors. Everybody knows that by now. So if you look at our hospitalizations among the county, you can see that we've been pretty flat to slightly starting to come up over the last week or two. So I think that's where you're seeing going over 10 and being into the yellow is this dip. Again, it's not January of 2022. Look at that peak, or the original. This is the Delta peak of January of 21. This one had a much higher. So this first peak back in 21 had a much higher death rate, much higher severity to it. This next one had still had a lot of severity to it, but the sheer number of case counts is what put people in the hospital there. And now we sort of meander. We had a little bit of a peak in May, and then we flattened out and was on an upward trajectory, but not like a spike at this point in time, looking at that chart. Again, this is the CDC. They post this every week. Looking at the entire country, you see a lot more. You have 45.8% of the country on high, 35% on medium, and 18% on low. Again, a lot of the southern states, it is the time that they're indoors more. It is hot enough lately. Brings people inside, congregate in tight areas, things like that, and you have you tend to turn more orange. So it's more their winter, so to speak, like we would be more locked indoors together in the wintertime. They are in the summer. But you see mainly the Northeast and some of the northern plain states. I wouldn't count northern Nevada. I don't think anybody really lives there. So, a lot of these areas here are just sparsely populated. So I think where it's best is sort of in that Minnesota, Wisconsin area type of thing, the Dakotas. And in New England, we're not seeing it quite as bad as the rest of the country, especially the southeast, basically from New York to Florida over to East Texas is up to Chicago is mostly in the high. And this is a very tight bar, so it's not like all these orange places, the hospitals are overwhelmed and people are being taken care of in hallways and makeshift. It's not, there may be places that are like that, but by and large, that's not what this high is. Hospitals can still, for the most part, I think, handle the high part, unless it gets really high. There's no category above it. But so, there's definitely a lot of COVID around. There's a fair amount of COVID on the Cape. Again, going to Massachusetts, you see about 10,000 cases in a week, and this was like 7,500, I think. So you're at 10,000. So there's been an increase over the week to week because this is not done daily like it used to be. This is done weekly, so it's 9,954. So basically 10,000. It was 7,000 something last time we did this. So and the positivity has been on the high side as well. So there's a fair amount of COVID, even if you're green or yellow. There's still a fair amount of COVID around. Again, the total case counts will never be known with the home tests. You can see that deaths never really taken off. Again, we have vaccines and boosters, and most elderly or immune compromised have been encouraged to get the vaccines and the boosters. Also, we have Paxlovid and other therapeutics, and we know how to manage it a little bit better from a healthcare standpoint, so you don't see that sort of blipping up maybe to the same extent that you would have in the past. Case counts are sort of there, meandering on towards a little bit of an upward. You see a little bit of an upward here for hospitalizations among the state. You see a little bit here in the Cape. And so that's sort of a similar holding pattern everywhere since the summer, at least here. MWRA numbers, you can see again, it's meandering. It's still in that 500 to 1,000 range. It's been like that basically since, I would say, mid-May. Same thing, mid-May, mid to late May. In the other region, the green is the North Shore. The orange color would be the south shore of the MWRA, which is their wastewater. This is basically detecting RNA signals of COVID in wastewater. And so you don't see the giant spikes, you see sort of a consistent presence of it, is maybe the best way I can say, and that's what we're seeing here as well. Again, positive, this is our incidence rate. You can see we're not the darkest color, but we're on the dark side. We've got 23.5, which is on the upper third of incidence. So again, plenty of COVID around. Our positivity is sort of also in the middle. Everybody's sort of in that 7 to 10 range, most of them, a couple of outliers. But again, like I said, there's plenty of COVID. It's been sort of consistent all year. As far as vaccine, again, there's plenty of vaccine left. I check every, Nurse Kathy checks for me every couple of days, once or twice a week, I would say. And there's plenty of openings at pharmacies, convenient MD. There's a lot around. If you come into town and there's someone homebound that you have, or you're visiting your relative or a friend and they're homebound and they haven't been vaccinated or boosted, you call the health department, the 508-495-7485. We'll send someone out from the VNA to take care of that. But again, plenty of open spots, plenty of opportunity to get vaccinated. Testing is still the same. Hospitals got testing, convenient MD, and the pharmacy still do testing. Most people use the home kits. Just remember, we're not going to call you from the health department. We're not going to know that you had a home kit. So there isn't a little bit any follow-up with that. The guidance, if you do have COVID or you want to know isolation, quarantine, it's pretty well written on the mass.gov site. It just basically shows you the 5 days and what to do, and mask after that, and go through the process. It's pretty well laid out. So it's right on mass.gov's website. You can just type in mass.gov isolation and quarantine COVID in a web browser, and it'll get you right there. And so if you need help with that, you can always call the health department or email us, but it's pretty self-explanatory what to do if you find a home kit. If you get a test that's positive, either at a home setting, work setting. If you work in healthcare, you're still getting tested probably weekly. Or if you get a PCR test so there's plenty of guidance out there. It's pretty well laid out. Vaccinations, we had 261 over the past week. Some of them were first doses, some were second doses, and most of them were quantified as boosters. So we're well vaccinated in Falmouth, and that's kind of where we are. They did change the population. They used the new census, sort of threw the percentages a little bit different. If you've been tracking it, the percentages are just a little different because the population numbers were updated with the new census. As far as what variants out there, you've all probably heard of the BA5. The BA5s are represented in the darker green. The BA4 never really took over. BA5 sort of beat it up, took it over. So it's sort of just meandering there. The BA212, which was the predominant one back in May and June, and is now drifting away. The BA2 is essentially gone. The original Omicron in purple, you can see in the far left, that's essentially gone. So BA5. There's another one out there, I think it's the 2.5. And that's just the way it's happening. You can just see one color takes over for an X, takes over for an X, takes over for an X, and I can't see any reason why that would stop anytime soon. So that's the variants. This one is definitely more transmissible. And they're just getting better at evading. And luckily, they haven't really morphed into anything more with the lower respiratory issues that you saw a lot more with things like with variants like Delta. So again, this isn't a call for an alarm. It's just saying that your likelihood of getting COVID with these new variants and as your vaccines wane, and as the virus shifts away from its original versions, all the vaccines were based on the original versions, you start seeing drifting, and you see more breakthrough cases. But there's enough memory in the vaccine, and these are generally more upper respiratory, that you're not necessarily getting the same percentage of hospitalizations of cases that you would have seen in the past. It took a lot less cases to fill a hospital. So if you look at a county, total number of cases in a county, how many people are going to the hospital, it was much higher before the vaccine. But the sheer number of cases that we have, because there's a lot of cases because these are better at spreading, hospitalizations would dip up, but they don't seem to be, they're not getting to any call for an alarm at this point. So I hope I explained that well. So as a recap, our cases are pretty stable at this point in time. Throughout the country, there are places where it's definitely going up, especially in the warmer climate parts of the country where the everybody's in on the AC because it's 97 degrees out. There's plenty of vaccine, plenty of testing, plenty. There's home kits available. I gave some to the senior center and to the service center and to the housing authority over the last couple of weeks. We were able to get some. And so there's plenty in the private sector, plenty of test kits around for you to get. You should keep some on you. Just remember there is a 6, by the time you get it, there might be 5 to 7 months left on the use by date. So try to rotate them at your house. If you're one to hoard them, you may end up having to throw some of them out. So keep track of there are use by dates on them. And the ones that we sent to Service Center and Senior Center, they actually had an extension by the FDA into October. So the use by dates actually said July on them, but they got the approval to extend that. So those have all been extended into the fall. Booster doses, again, available for those over 50 or those less than 50 with comorbidities. Boosters are something to consider. I know they were looking at changing the booster formulation for the fall. I don't have any information on that. The BA.5 right now is the dominant strain. Ask me in 6 weeks, 8 weeks, it'll be something else. It just seems the way it is. There are no mandates other than an advisory in town-owned buildings done by the select board. There are no mandates. There are no talks at the state level about mandates or mitigations at this point in time. Just to let you know, I don't know if there will be. I don't know if there's a lot of desire for those. And so right now we're not seeing anything coming down on that. Again, you consider your own individual circumstances, your health status, or relatives' health status, or a friend's health status, and you make your decisions based on that. So that's our update for the week. Similar pattern to last week. And so we'll see what we get for next week or the week after. And everybody enjoy their summer. Thanks.